This is the second of two short videos in which we're going to look at a commonly held belief about sex and the pelvic floor and decide if it's fact or fiction. So belief number 2, I've had a baby, sex won't be the same again. Antenatal education can really help prepare for delivery, but at the moment, postnatal support for a new mum isn't done well here in the UK. However, things are changing, and on the back of recommendations from the Better for Women report, GPs are going to be given a little longer to review a new mum's health at her 6-week postnatal check. In the meantime, the feedback we hear is that discussion about sex just focuses on contraceptive advice. Now, we know having a baby can have a huge impact on a couple's sex life. Mental and physical exhaustion usually means that bed is for sleep. And everything feels a bit different down there for a while, and sometimes women, they don't even want to look. There's often bruising, swelling, soreness, reduced sensation, often stitches, and the combination of all of these things happening in an area that's usually protected from trauma can be a bit of a shock. The timescale for recovery is really variable. Some women bounce back very quickly. We know soft tissue healing takes around 6 weeks, but there are so many other things to take into consideration. So the message is every woman is individual, and this variable timescale applies to resuming penetrative sex. Taking things slowly and gently is advised, and using a good quality lubricant can be really helpful. It's helpful to think of the trauma as being similar to a sports injury, and we know movement can help to speed recovery. The same principle applies to the pelvic floor area. Gentle pelvic floor exercises can really help to reduce swelling and pain in the early days. New mums often experience urine leaks, difficulty controlling wind, or feel the need to rush to the toilet when they need to have a bowel movement. And all these issues are going to affect feeling confident about intimacy. It's also really common to struggle with body image and a feeling of just wanting everything to be back to normal. So why does pelvic floor muscle rehabilitation help improve sex? Well, while the biggest section of the pelvic floor muscle lifts upwards and forwards, giving support to the pelvic organs and reducing the risk of leaks and increasing circulation, there's also a smaller section of muscle that attaches to the clitoral area, pulling downwards and backwards and compressing these sensitive tissues. So both parts of the pelvic floor have an important role to play in sex. The most important shout-out message is after a vaginal delivery, you shouldn't be left with any of these issues. If you're struggling, then speak to your GP, midwife, health visitor, and they should be able to signpost you to the most appropriate service. The Mummy MOT is a great way to be fully checked by a pelvic health physio. Just visit their website to find out someone in your area. So fact or fiction, I've had a baby, sex won't be the same again, that is fiction. Sex may be different for a while, but you should be able to have a satisfying, pain-free, enjoyable sex life. And finally, a fact to take away. If you have any pelvic health issues, not just as a new mum, but at any time in your life, if you're thinking about buying a pelvic floor device, don't just Google it. Seek professional advice and guidance.